Class II Composite Restoration. Select the composite shade prior to rubber dam placement. Composite-type matrix system will be used in this exercise. Place contoured matrix band. Select a matrix band that most closely approximates the occlusogingival height of the tooth. Insert wedge for optimal contour and gingival seal. Note the gingival and lingual seal. Spread the ring using the matrix forceps. Place the matrix mesial to the wedge. Burnish the band in the desired contact area against the adjacent tooth and make sure that there is no spring back of the band. This will ensure an excellent contact. Use an explorer to check the gingival, buccal, and lingual seal. Apply Scotch Bond etchant to enamel first, 15 seconds, and then to dentin, 10 seconds. Rinse and gently dry for 2 seconds. Do not desiccate. In this exercise, OptiBond Solo Plus, an etch and rinse adhesive system, will be used. Apply OptiBond Solo Plus to enamel dentin for 15 seconds. A brush tip or air can be used to thin out bonding agent inside the preparation or remove any excess from the cable surface margins. Light cure for 20 seconds. Note: place the light tip perpendicular to the occlusal surface. Arrange appropriate armamentarium for placing and shaping composite. Use an alcohol wipe to clean composite instrument tip before and during composite placement. Filtek Z250 microhybrid composite is the restorative material of choice. Using a composite instrument, place a small composite increment, 1 to 2 millimeters, into the preparation. This incremental fill reduces polymerization contraction, C factor. Condense, shape each increment using a composite instrument. At this point, composite increments are added and condensed to the lingual wall of the proximal box. An explorer tip or a coated plastic instrument can be used to remove excess composite and shape the lingual embrasure. Light cure for 20 seconds. Composite increments are added and condensed to the buccal wall of the proximal box. Light cure for 20 seconds. Light cure for 20 seconds. Continue adding and shaping composite increments to the pulpal floor, buccal, and lingual walls of the occlusal portion of the preparation. Microbrush can be used to remove excess composite from the cavo surface margins of the preparation. Light cure for 20 seconds. Light cure for 20 seconds. As the final composite increments are added, anatomical burnisher is used to place appropriate marginal and occlusal anatomy before curing. A cleoid can be used to remove excess composite from the cavo surface margins of the preparation. Light cure for 20 seconds. Remove the wedge and the matrix band system. Use carbide finishing burrs from the composite finish and polishing burr block to define and smooth occlusal anatomy. Plastic softflex discs can be used to shape the embrasures by removing overhangs. To polish the interproximal contact, composite polishing strip can be used. Note: caution must be used not to remove contact. Ensure polished interproximal contact. Floss should not shred. Use rubber polishing points to further polish the restoration. Use sequentially from coarse to fine grit: green, yellow, white. Place a Jiffy composite polishing brush, regular or pointed, in a slow-speed handpiece. Apply firm pressure to high polish shine the restoration. After rubber dam is removed and occlusion is checked, the restoration is cleaned and etchant is applied for 5 seconds. Rinse and dry. Apply a thin coat of Permaseal for 5 seconds. Air thin. Before curing, remove any excess Permaseal by flossing the interproximal contact. Light cure for 20 seconds.